Everyone, you're watching YouTube with YouTube. Today our topic is antimicrobial therapy. Now this is a bacterial cell. The outer layer is the bacterial cell wall. The inner one is the cell membrane. Now bacterial plasmid has a double-stranded DNA. So this is the bacterial DNA, which will undergo replication. So there will be a nick and then a replication fork will be formed. All those are the procedure of the replication, which you already know. So here comes the DNA gyrase. Which will reseal the supercoils. Then a part of it will undergo transcription. So this is the RNA polymerase, which will make mRNA, which will undergo translation. So there will be the formation of ribosome. Now in a prokaryote, the ribosome is of 70S type, which has a subunit of 50As and a 30As. Now bacteria has metabolism for folic acid. So this is PABA, which will be converted to DHF, that's the hydrofolate, and then to the tetrahydrofolate. Now PABA is para-aminobenzoic acid. Now antimicrobial drugs will target each of these components. So let's have a look on the antimicrobial drugs which are used to target these components. So the first one will be on the bacterial cell wall, which will be inhibiting the cell wall synthesis. So here I write drugs that inhibit bacterial cell wall synthesis. There are two types. Some that inhibit the peptidoglycan synthesis, and some that prevents the peptidoglycan cross-linking. Peptidoglycan cross-linking. Now in case of the drugs that inhibit the peptidoglycan synthesis are the glycopeptides like vancomycin, then bacitracin. Here in case of peptidoglycan cross-linking inhibitors, we have penicillinous sensitive penicillins like penicillin G, penicillin V, then ampicillin, amoxicillin. Then some are the penicillinase resistant penicillins like oxacillin, then nafcillin, then dicloxacillin, and some carbapenems like imipenem, meropenem. Now let me just write down. Well, there's no space to write over here, so I'll just write down below. Like this group belongs to penicillinase sensitive penicillins. This belongs to penicillinase resistant penicillins. This are the carbapenems, Please don't mind the shaking because I'm recording with my left hand and writing with my right hand. So another group is the cephalosporins, which include, now cephalosporins are of many generations. The first generation is cefazolin. Second generation is cefoxetine. Third generation is ceftriaxone. Now ceftriaxone is one of the most commonly used drugs. Then fourth generation will be cefepime, and the fifth generation is ceftrolin. So these are the cephalosporins. Now we have another class of drug, which are the monobactams. Where should I write? Just let me write down somewhere, like monobactams. Okay, just remember the example of monobactam is aztreonam. Where should I write? Okay, fine, I'll just write down somewhere here. Aztreonam, which is a monobactam. Okay, now we have another class of drug which inhibits the cell wall synthesis. Okay, sorry, this were the drugs which inhibit the cell wall synthesis. Now we have another class of drug which inhibits the membrane integrity. So drugs, drugs that inhibit the membrane integrity will be daptomycin, which is mainly acting against the gram-positive bacteria. Another one is the polymyxins, which act against the gram-negative. Now here comes the folic acid synthesis and reduction inhibitors. The folic acid synthesis and reduction inhibitors, which are sulfonamides, like sulfamethoxazole. Then there are many, like sulfoxazole, then sulfdiazine, and some are trimethoprim. Now we have another class of drug which will inhibit the DNA synthesis. So drugs that inhibits the DNA synthesis. I guess this pen is not working, so let me use this black one. Metronidazole. So metronidazole is a drug that inhibits the DNA integrity. Then we have drugs which will act against mRNA synthesis. So this is mRNA. I can't actually point it because otherwise my diagram will become clumsy. So drugs that inhibits the mRNA synthesis is rifampicin or rifampin, most commonly used against tuberculosis and leprosy, also called the Hansen's disease. Now drugs that inhibit the DNA gyrase, so DNA gyrase inhibitor, I'll just write down here, like fluoroquinolones, fluoroquinolones like ciprofloxacin, levofloxacin, some quinolones, nalidixic acid. Well, I don't have any space remaining to write about the drugs that inhibit the protein synthesis, so I'll just mention them below. So drugs that inhibit protein synthesis, which will inhibit the 50S ribosome, and some will inhibit the 30S ribosome. Now first we see 50S, that is chloramphenicol, Please don't mind all these things because I'm holding the camera with left hand. I'm actually looking through the camera at the paper. So please ignore all these mistakes. So chloramphenicol. Then clindamycin, linezolid, some macrolides like azithromycin, clarithromycin, erythromycin, then streptogramins like dalfopristin. Now for the 30S we have aminoglycosides, aminoglycosides like gentamicin, neomycin, amikacin, tobramycin, streptomycin. Please ignore all this shakiness and mistakes because I'm actually looking at the paper through this camera and holding the pen in my right hand. So then we have another class which is glycylcycline, like tigacycline. Then another class of drugs which are tetracyclines, like doxycycline, then minocycline. Okay, so these are the class of drugs which act against the bacteria in case of bacterial infection. So thank you for watching my channel.